Welcome to Raw Online, and I am Dr. Jay Kumar, and today I am going to take you through the topic on coagulants and anticoagulants. So here the competency we are going to discuss is describe the mechanism of action, uses and adverse effects of different types of anticoagulants. And so the specific learning objectives for this particular topic is classify anticoagulants, and you have to explain the mechanism of action, uses and adverse effects of unfractionated heparin, that is high molecular weight heparin, and also there is a low molecular weight heparin is there. Then we have to differentiate between high molecular weight heparin and low molecular weight heparin, and these are the parental anticoagulants, the heparin, and of course the oral anticoagulants, which is nothing but the warfarin. So we are going to discuss about the mechanism of action, uses and adverse effects of warfarin, and then finally the direct thrombin inhibitors and factor 10A inhibitors. Some of the new drugs come out for factor 10A inhibitors, and brief about the antifibrinolytic drugs, its uses and adverse effects. So these are the specific learning objectives for the today's talk. So first we are going to see the different classes of drugs that can be used in this particular chapter. The one is a particular class which prevents a coagulation, that is called anticoagulant. Examples, as I told you, warfarin, which is a oral anticoagulant, whereas parental is heparin, high molecular weight or low molecular weight heparin. Then the second thing is which dissolves the clot. That means the fibrin clot which is formed, like in coronary artery disease where the big clot is formed, which is full of fibrin threads. So to dissolve that clots, we use the category called fibrinolytics. And then there is another class of drugs which prevents bleeding and hemorrhage, which is mainly in the capillary level, the small bleedings like epistaxis, those kind of things, and which is called hemostatic. That is another class. And finally, when there is a deficiency of the coagulation factors, which we have studied in the physiology, nearly 13 coagulation factors which play an important role in the coagulation cascade. So when there is a deficiency of the clotting factors, we have to replace with those factors. So these are the different classes. So one will prevent the coagulation, that is anticoagulant, and then which dissolves the clots, which is fibrinolytics, and then which acts at the capillary level to prevent the capillary leakage and other things, that's called hemostatics. And then finally the clotting factor deficiency, which is corrected by replacing with the factors. So coming to the hemostasis, what do you mean by hemostasis? Hemo means blood, stasis means just stagnation. So whenever there is a bleeding, whenever there is a tissue trauma, so we have to reduce the bleeding first, the blood loss. So the process which happens to minimize the blood loss, that is called the hemostasis. So how it will happen? There are 4 phases are there. The first phase, if you see the vascular phase, that means whenever there is a tissue injury, the blood vessel gets injured. So the smooth muscle cells of the blood vessels, they go in for constriction. So it will go for vasoconstriction. That is a vascular phase. That is the one way it tries to prevent the blood loss. Then next phase is the platelet phase. So what happens? Once the endothelial get damaged, the vascular endothelium gets damaged, the platelets will all accumulate and then they attach each other, which I am going to explain briefly in the physiological aspect. The third one is the coagulation phase, where the clotting factors will come into play a role to coagulate, and then so the clot will be formed to minimize the blood loss. And finally, the last phase is the fibrinolytic phase. Okay, so these are the 4 phases which I am going to briefly discuss now. So first phase is a vascular phase. So as I said, whenever there is a vascular injury, tissue injury, the blood vessels gets injured, and then the smooth muscle cell of the blood vessels, they go in for contraction. As a result, there will be a vasoconstriction. So once the vasoconstriction happens, it will try to reduce the blood loss. And at the same time, the exposure to the tissues activate the tissue factor, which is released from the tissues, and that initiates the coagulation process. Because you have got 2 types of coagulation cascade pathway. One is the intrinsic and extrinsic, which I will be dealing in the coming slides. And then if you take the extrinsic pathway, which is mainly based on this tissue factor. Okay, so whenever there is a tissue injury, the tissue factor is released, and that is going to initiate the coagulation process. And before that, the vasoconstriction happens, which is going to reduce the blood loss. This is the first phase.